Here is the scapula. As you see, it's not a long bone, it's a flat bone. So it has a triangular shape, and it's located on the upper part of the posterior surface of the costal wall. You see here the right and left scapula, and it articulates with two bones. You see it articulates with the clavicle, with this joint, which is called acromioclavicular joint here, or AC joint. It also articulates with the head of the humerus, arm bone, which is called glenohumeral joint or shoulder joint. Bear in mind, it does not articulate with the thoracic wall. You see it's movable. Yeah, in this part you can see it's movable. It's not articulating with the thoracic wall. It just articulates with the clavicle and humerus. And you see here, it has a triangular shape. So it has three angles. You see here is the superior angle. Here is the inferior angle. And here is the lateral angle. The lateral angle, we have a cavity, which is called glenoid cavity. As I showed you, it articulates with the head of the humerus and they make glenohumeral joint or shoulder joint. And we also have three borders. Here is the superior border. Here is the medial border, and here is the lateral border. How you should identify the lateral border? As I showed you, here is the glenoid cavity. Glenoid cavity makes the lateral angle. So here is the lateral border. Opposite to the lateral border is medial border. We also have three processes. One of the big processes of the scapula is this. On the posterior surface, we have a spine. Here is called spine of scapula. And it extends laterally and make another process, which is called acromion. So in situ, you can see spine of scapula extends laterally. It makes the acromion. And you can palpate your acromion because it's located at the top of the shoulder joint. Acromion means top part of the shoulder joint. Acro means top, mio means shoulder. At the top of the shoulder, you can palpate it. And the third process is this, which is called Coracoid process. So we have three processes: spine of scapula, acromion process, and coracoid process. It faces forwardly and laterally. You see anteriorly and laterally, and you can palpate it here, just under the acromial end of the clavicle. You can palpate the coracoid process here. It has two surfaces. Here is the anterior surface. Here is the posterior surface. It's a flat bone, so it has two surfaces. Anterior surface has a fossa. It is called subscapular fossa. It gives an attachment to the subscapularis muscle. Here is the scapula. So here's the anterior surface of the scapula. It is covered by this subscapularis muscle you see here. And as I mentioned before, posterior surface of the scapula has a spine. Spine of scapula splits the posterior surface into two parts. Above the spine, we have supraspinous fossa. Below the spine, infraspinous fossa. They are covered by the same name of the muscles, supraspinatus and infraspinatus, that you can see here again. Here is the scapula. Here is the spine of the scapula. So you can see supraspinous muscle covers the supraspinous fossa, and infraspinatus muscle, supraspinatus, infraspinatus muscle below the spine covers the infraspinous fossa. And we also have a notch here. Here's the superior border. So this notch is next to the root of the coracoid process in the superior border of the scapula, which is called suprascapular notch. Suprascapular notch. Suprascapular nerve passes through the suprascapular notch here and innervates these two muscles that I showed you. Thank you.